Hi everyone, my name's Nathan and I'm from the European Pain Federation, and today I'm joined by Professor Luda Diatchenko, and today we're going to go to talk a little bit more about their plenary session at this year's EFIC 2023 Congress in Budapest in September, which we're all looking forward to. Luda, again, welcome.
Thank you, Nathan.
Hiya. Thank you so much for taking time to speak to us today. I really appreciate it. So just to start us off, would you like to tell us a little bit more about who you are and what your background is?
So Luda Diatchenko, I'm professor at McGill University in Canada, Quebec, in Montreal. And my expertise is in human pain genetics.
Amazing, amazing. So just dwelling on that a little bit more, what's going to be the focus of your session at the EFIC Congress this year?
So I will talk about translational research. What did we learn so far? What is our limitation and what we are trying to achieve?
Okay.
And I will give you my perspective of the human pain geneticists on this.
Amazing, amazing. We're really looking forward to that. Really looking forward to it. So based on your research so far, how hopeful are you that we can reach sort of the aspirational goal of precision pain medicine, which will obviously allow us to personalize pain treatments to specific patients? How hopeful are you that we can reach that? And could you explain to us what we would need to do to be able to reach that?
Yes, of course. So we all want to develop personalized approaches to treating human pain. And largely is because we observe that chronic pain patients are very heterogeneous in a way that seems to, even if we are talking about the same disease like low back pain, each patient will present with a little bit different constellation of the symptoms, for example, and complaints. And it's thought that, probably we have a little bit different pathophysiology, or largely different pathophysiology underlying each particular case. And so genetics is something which people look up to in trying to explain these differences. And there is probably a lot of truth in this hope. And over the years of my research, this was one of the goals I was trying to achieve. So you ask how hopeful I am. I'm hopeful. I'm hopeful how close we are. Yeah, I don't think it's gonna happen next year because I think doing genetics over years, it became clear that chronic pain is really even more complex than we thought. We do use this word. We do use this word of complex disease, pain phenotype, and chronic pain condition. But the genetic architecture which underline this condition is even more complex than we thought. There's even more genes and pathway involved in people developing chronic pain. So we need just a little bit more time to further understand the so-called genetic architecture, right? So exactly which gene contribute, how they contribute, at what time, which gene and cells contribute. So, but it's happening for sure. And what is clear right now that even pain conditions are heterogeneous, there is definitely some central component in this, something which is common between everyone. And this is even regardless the type of chronic pain condition. For example, there is a substantial genetic so-called correlation between, for example, abdominal pain and low back pain. Genetic correlation means there are substantial amount of the same genetic variants which contribute to both. And yet there is common component and there are the specific components, right? So in the specific component which make a flavor for each specific person. So you also asked me what should happen, and how maybe my talk is related to this question of what next could happen. And so, not surprisingly, as a human pain geneticist, I would say we need to do more human pain genetics. And this because, what I observe and what I believe is animal models are very good in validating human genetic findings. But without getting the information about pathophysiology of human chronic pain from human, animal models are limited because just because animals show pain behavior or experience pain, it doesn't mean that our patient experience pain the same way. But when we work with the human and when we work with human genetic data sets, we know that this is real human who really experience chronic pain. Mm-hmm. So that's why I think that that's why I'm doing this, right? I believe in using human data to build understanding of human pathophysiology, or again, the exact way how the event of developing pain happen and why people stay pain or resolve pain. And then so we should use an animal model to validate our finding from human genetics. And this is what I will largely talk about, I think that this is our central problem in translational research, that we should pay more attention to human, this is again my perspective, but of course I will bring the argument and example that maybe if we pay more attention to human data, validating in mice so-called back translation, we will be maybe not necessarily further away, but this is component which are lagging behind in my perspective. So then we can embrace both human and mouse research to build the understanding and pathophysiology of human pain. And once we will do this, then personalized medicine will be, it can be brought up easily, right? Once we parcel out the components of it.
Mm-hmm, mm-hmm. That sounds super interesting. Talking about the different approaches, and I think that's going to really, really create some interesting discussions at the Congress this year. Obviously, being able to have a chat with yourself, if people are able to grab you, that sounds super interesting. And you've already kind of answered the question of, why should people come to see your talk? And I'm sure people will do so. I really appreciate you taking time to talk to us today. I hope that's given people a lot more information about why they need to come and see your talk. And I'm really looking forward to seeing you at the Congress this year and obviously hearing more about your thoughts.
Thank you very much. And I'm looking forward to the Congress, to discussion, to question people will ask, and all other interaction during the meeting. So thank you very much for talking to me. Yes.
Amazing. No worries. Thank you so much for your time today.